Okay, I've got a large wart here that's on the bottom of the right foot. It's been very painful for quite a while. And having discussed some options with the patient about what they would prefer, they elected to have us remove it, which is just one of many different methods for getting rid of warts. So we're going to go around the outside here of this, and we're going to just simply break through the superficial level of the skin. Warts will go down to the level of the dermis. There are two layers to the body's epidermis. One is the outer layer, the second is the deeper layer, or the dermis, and usually a wart will go down to that level. And so what we're doing here is to just kind of disattach the superficial levels so that we can get after that and scoop it out. So once we've gone all the way around the lesion here, we're going to just get all the way around it, and we're going to make it easier to kind of scoop it so that it comes out in one solid piece. And you can kind of sense how big this is just from the outset, how it kind of moves separately. So we're going to use our larger curette. We're going to kind of just ice cream scoop it, is what I call it. But we're essentially just trying to put some pressure, and you can see how the wart just wants to separate. That's just what unhealthy wart tissue looks like compared to healthy tissue. And so it's easier to separate that layer. And we'll just do one of those numbers. And you can kind of see where the wart, this looks like it's got multiple in it. There are lots of little warts that are connected here, but you can see the deficit that it leaves inside because he's been walking around, our patient's been walking around on that, poking into the skin this whole time. So it leaves kind of that little craterization effect. And what we're going to do is we want to make sure we got all the wart tissue. So we've got to get down here past these layers and just make sure that we can see him again. Warts are caused by a virus, and the virus will come in and it will hijack our body's skin cells to reproduce more virus. And so what we're doing is to just make sure that we don't have any more visible wart tissue. I'm kind of bumping that with my curette. Sorry about the camera movement there. So now you can kind of see that we're down to that point, and it might be a little tough, but if we magnify this, you can actually see the skin lines. This is what normal tissue should look like, and these skin lines give us a good idea of where does the wart start and stop. And as long as we can see that, hey, we don't have any more of that wart tissue and we can see really clear skin lines, we're done.